A lot of my pregnant clients will tell me that friends, family, even strangers will say to them, just get the drugs. Don't be a hero. But what if using the power of your mind is the best gift you can give your baby? What if natural birth means that you are getting really good drugs? And what if natural birth is the safest way for you and your baby? The natural birth and what your body makes, it's anesthetic your body's used to. Your baby actually also makes this, which shows how safe it is. Good for you, good for your baby. Perhaps you've heard of endorphins. Endorphins are one of the many powerful drugs that both your body makes and your baby makes during birth. The fact that your baby makes endorphins shows how safe this is for your baby. Research shows that the natural hormones, the natural bacteria, the natural neurotransmitters that happen in birth, such as oxytocin, endorphins, and more, help prepare our babies for life outside the womb. Now, what if your mind was pretty powerful? What if it was more powerful than you realize? Hypnosis is a safe and potent way to tap into the power of your mind for everything from achieving goals, letting go of bad habits, medical applications, dental uses, creating calm and peace in the settings that you would like, and so much more. Hypnosis is so natural that the typical side effects are calm, inner peace, and comfort. Natural enough that most people don't know that back in 1956, Pope Pius XII announced that the Catholic Church deemed hypnosis acceptable for childbirth, treatment of disease, for pain relief, and in research. And most religions see the value of hypnosis. Additionally, in medicine, many doctors, dentists, midwives, psychiatrists, psychotherapists, emergency workers, and other healthcare professionals have done training in hypnosis to add to the care they provide. And most people just don't realize how much medical research there is on the topic of hypnosis. A quick search on PubMed.gov shows that over 15,000 published documents, including randomized controlled trials on everything from IBS to cancer care, childbirth, surgery, pain management, mood issues, and more, are available. As I've mentioned in a previous video, I used hypnosis for my first birth, and I loved the entire experience. Hypnosis is the safest way to create pain relief. And you can use hypnosis and also have pharmaceutical pain relief in addition to the hypnosis you're using. There are even case reports of people using hypnoanaesthesia for surgery where hypnosis was the only anesthetic. This includes surgical birth, such as caesarean. The obstetric epidural is the most common form of pharmaceutical pain relief today in North America and most countries around the world. In my area in southern Ontario, the rate of epidurals in hospital settings is anywhere from 60% to over 95% of births have an epidural. Epidurals only happen in hospital settings, and it's medication that's injected in the spine where you're numb from the waist down. There are other types of anesthetic called spinal anesthetic and combined spinal anesthetic. For our purposes, it's all about the same in terms of how it affects you and your baby. With an epidural, you usually cannot bear weight, so you can't stand up and move around. You're usually confined to bed. Everybody will get an IV with an epidural because typically the blood pressure will drop significantly, and sometimes a half a bag or even a whole bag of saline solution is given before the epidural is administered to help counteract the drop in blood pressure. Sometimes people will need a urinary catheter. That's a tube that goes in the urethra and drains urine out into a bag. Common side effects for an epidural include that blood pressure drop that was mentioned earlier, and inadequate pain relief. So sometimes pain relief happens on one side of the body but not the other side, or it's just not quite good enough, or they need to do a number of attempts to get the epidural in place. Spinal headache is not that common. It's only about 1%, but it's a headache that can last about a week or so. The way to deal with the headache is to lie flat in bed. So getting up or lifting your head up is extremely painful. And anybody who's had a new baby, it's really difficult to lie flat on your back and look after your babies. Spinal headaches can be very, very difficult. They can be fixed with something called a blood patch, but ideally the spinal headache never happens in the first place. Serious outcome from epidurals is quite rare. If you want some more information on the benefits and risks of epidurals, take a look at this article on evidence-based birth. And what's in an epidural? Typically, fentanyl is one of the primary drugs. Fentanyl is an opioid. It's a powerful narcotic, and it's usually combined with one of the cocaine-based drugs. Any drug that ends with cane is a cocaine-based drug. Typically, the two drugs are combined because they potentiate each other, and what that means is lower amounts of both are needed as opposed to just using one of them. The drugs in an epidural cross the placenta to the baby. Most people don't know this. And the longer the epidural is in place, the more medication the baby will receive. And most babies tolerate epidural medications well, but we just don't have the long-term research on the safety to babies. Typically, if you look at the research in the breastfeeding world, they'll talk about jitteriness in newborns where there's been an epidural in the birth, and jitteriness is a code word for withdrawal from a narcotic. Those of us who are birth professionals think that the epidural use in birth plays a significant role in the high incidence of what's called emergency caesarean. Emergency caesarean is the term that's used as when a caesarean is decided upon in birth. It doesn't mean that there's an actual emergency. There are two types of caesareans, emergency caesarean and planned caesarean. Most emergency caesareans are decided upon and actually happen, and then there's a long gap, time-wise, often many hours from when the decision is made to when the surgery happens. Clearly, in those situations, it is not an emergency. Most emergency caesareans seem to occur when a baby doesn't tolerate a medication given to the mother, and then it becomes important that the baby is born sooner rather than later. Planned caesarean happens when decision for the surgery is made before the actual birth starts. So what if reducing or maybe even eliminating medical anesthetic could give your baby the best chance for a safer birth? What if using the power of your mind allows you to be mostly or even completely comfortable during natural birth? What if your ability to use your mind is one of the best gifts you can give yourself and your baby? For a free copy of the pregnancy relaxation and other recordings, more information about prenatal classes and services provided, go to childbirthjoy.com.